Welcome to our Learn Community Education session. Today, we are going to be talking about rethinking brain injuries. I'm Dee Childers with Life Changes Elder Care Consulting and also the Vice President and Coordinator for Community Education. And as I mentioned, our topic today is rethinking brain injuries. Okay, now I'm only on one screen, so page down should work. This education is brought to you by Learn. Learn is Lifelong Education and Aging Resource Network with a mission to provide community education on aging and caregiving related topics, and free is a big part of that. Learn is part of the Leaders Network, which is part of the Society for Certified Senior Advisors, and the website is there. SCSA is an organization that educates and certifies professionals working with seniors. Today, a little disclaimer, the information is provided for informational purposes only, and you do need to seek consultation with your legal, financial, and healthcare professionals prior to taking action based on that. Our sponsors today are Oasis Senior Advisors, providing free personal senior living assistance with trusted local advisors. These folks go out of their way to help make sure that the right place is chosen at the right time and that the process goes smoothly and with great support. And our co-sponsor today is A Mind for All Seasons. Thank you again for Eric, not only for being a presenter today, but for being a sponsor of our training this quarter. Mind for All Seasons is leading the revolution in brain health for individuals and institutions with their comprehensive approach to brain health and healing. And we're going to be talking about a bit of an extension there today with what they're doing on brain injury. So Eric Collett is our presenter today from A Mind for All Seasons. And Eric is the principal and CEO of A Mind for All Seasons. He's a nationally recognized speaker, consultant, and dementia expert, a licensed ALF administrator, and teaches about dementia at college levels. Eric passionately believes that lifelong learning is a key to finding powerful new solutions to significant changes and has worked since 2000 to change lives through innovative dementia care techniques and leadership strategies. Prior to starting A Mind for All Seasons, Eric worked in traditional assisted living as a program director and executive director for 9 years, then spent almost 7 years as executive director of a memory care community where he developed innovative approaches to person-centered training care that make a significant difference in how persons living with dementia experience the world. Eric has served on the board of the Idaho Healthcare Association and currently chairs the Education Committee. He previously served as a board member and chairman of the Alzheimer's Association, Idaho, a 501c3 nonprofit organization. And welcome, Eric. I'm going to let you take it away today. I'm going to stop sharing my screen. I've got a little lisp today, and let you share yours and take it away.
Thank you so much, Dee. Thanks for everybody who's joining us. We were talking before we got started about how the sun's out a little bit more. It's not raining mud like it was yesterday. So maybe some people are out enjoying that. So if you're catching this on the replay later on, thanks for checking in and watching it. And if you're with us live, thanks for being part of the Vanguard group as we go down this road. Now, as we get started with this, I want to make a statement and then I want to share a story that basically comes from the experience that I've had in starting A Mind for All Seasons back in 2016. And I want to talk you through the evolution of how we got to the point that we're even talking about brain injuries today, because that's definitely not where I started out when I founded A Mind for All Seasons. So in the communication field, which is my specific academic discipline, we say that humans cannot not communicate. Everything that we do communicates. You could sit in the back of a classroom with your head down and try to pretend like you're invisible and you are communicating something. Everything that we wear communicates. Everything that we do in one way or another is communicating to other human beings. It's why communication is endlessly fascinating and endlessly challenging to try to figure out. And when I started A Mind for All Seasons, it's because I had spent 16 years working in the assisted living and memory care field, trying to figure out how to support people living with dementia and how to communicate more effectively with them. And that quickly morphed into the second thing that I want to say about communication, which is that behavior is an outward expression of an inner state. Whatever we see on the outside is just telling us something that is going on internally. So for example, if you look at an Alzheimer's brain in advanced stages, it is decidedly different from a normal healthy brain. It will be 50 to 70% less in volume than a normal healthy brain. You'll see, if you can see my cursor on the screen, lots of devastation down here in the area that's labeled the hippocampus. Plural would be hippocampi. That's the memory center of the brain. And in Alzheimer's disease, that tends to be ground zero. Therefore, the first symptoms that we tend to see are memory related. We now know that Alzheimer's starts 10 or 20 years before symptoms show up. And when they do show up, a lot of times people don't even recognize them because we've come in our culture to accept the idea that there's something about memory loss that's just normal. We expect that people lose their minds as they get older. And I think that's a crying shame because we now know there's nothing normal about that. Yes, things slow down by the time we hit our 30s and our brains aren't in sponge mode anymore, but we should have the ability to remember key essential details of life and remember people in our lives and remember how to go to the grocery store that we've been going to for the last 30 years throughout our lives. And when those things are declining, it's dysfunction. And you might say it's a type of injury to the brain. A disease that causes the brain to degenerate is a type of injury. So my team and I at A Mind for All Seasons started working with brain injuries in that manner pretty early on. We were asking the question, what can we do to help people with significant neurological dysfunction do better? If someone has Alzheimer's disease, if someone has Parkinson's disease, if someone has Lewy body dementia or vascular dementia, are there things that we can do that would help their bodies function better, help their brains function better, so that outwardly their ability to engage with other human beings would be improved, and thus changing the trajectory of their lives? If we could change the trajectory or the downward slope that people are on, if we could level it out a little bit and address some root causes so that people have better functionality, it would make a difference to the healthcare system. It would make a difference in their own individual life. It would definitely make a difference to the family and professional caregivers who are supporting them. So that's the road that we really started going down, especially as research started coming out. Research like that from Dale Bredesen. And if you were on the last presentation that I did for Learn, I talked a lot about Alzheimer's disease specifically. And I'm just going to touch on it here as part of the evolution of understanding what actually constitutes a brain injury. So Dr. Bredesen, just to recap or to inform you if you weren't on the last session, is an MD neurologist that's been studying Alzheimer's and other neurodegenerative conditions for about 30 years. Most of it as the founding president and one of the lead researchers at the Buck Institute for Research on Aging at UCLA. And in the process of trying to develop a drug for the pharmaceutical industry to treat Alzheimer's disease, he realized that the perfect drug would have to do all of this stuff. And you just can't make a drug that will do that much stuff. It's like trying to patch a roof with a whole lot of different holes. And you might be able to patch one hole really well, which is essentially what drugs that we have for Alzheimer's do today. One of the most common drugs is Aricept. Aricept, or donepezil, which would be the generic, helps the body have a little bit more of a neurotransmitter called acetylcholine. And acetylcholine is critical for memory, and it's actually critical for every function, every aspect of our neurological system and how things function. Our nervous system is dependent on acetylcholine. You can't even have normal, healthy bowel functioning if your acetylcholine is truly depleted. So people have tried making a drug that helps the body have a little bit more acetylcholine
I'd like to discuss on how you can connect with your spirit guides,
Let's see. We need
your
to
spiritual loved ones, anyone
shut
that
off
you would
the
like to make
additional sound that
communication
we're
with.
getting here. There we go. All right. Yeah, just make sure that you're muted in the background there. All right. So we might give someone Aricept and help them have a little bit more acetylcholine. And it's kind of like patching that hole in the roof. And you can measure that the house fills up slower when it rains, but it's still filling up. It's kind of like things have tipped. Basically, what's going on in the Alzheimer's brain is akin to what's going on when bones become brittle. Healthy bone is what happens when the rate of bone formation and the rate of bone breakdown are in dynamic balance. When they're equal and you're making some bone cells every day and you're breaking down roughly the same amount of bone cells every day, you have normal healthy bones. But when you tip the balance, you get osteoporosis. And various things could tip that balance, but the biggest one is loss of hormones, which is why women are at greater risk. It's also why women are at greater risk of Alzheimer's disease. Now, you might be scratching your head saying, wait a minute, I thought we were talking about brain injury, and all of a sudden you're talking about Alzheimer's disease. Well, we started out at A Mind for All Seasons developing a multimodal approach based on Dr. Bredesen's research and everything else that we could find from as many different researchers out there about how do we patch all of the holes in the roof. One of the reasons we have to do that is because of this particular receptor, amyloid precursor protein, which sticks out from the cells in the brain, kind of like a security camera, looking for the conditions out there. And if conditions are right, then the switch gets flipped one direction toward synaptic growth. The brain is healthy and we have a normal adult brain. If it flips the other way, then we have synaptic death. And we get a lot of enzyme activity that causes fragments of amyloid precursor protein that get clipped off to go out and basically send signals to the rest of the brain that says, hey, we're in trouble, we've got to downsize. So you can think of this receptor as like testing the water, so to speak, saying, do we have everything that we need in the soup that's critical for brain health? And what kinds of factors are there? You can think of brain health as like a balance, like the scales of justice. So think of it as a balance, and there are many different things that have to be present for the brain to be healthy. We've known for a long, long time that we need adequate levels of B vitamins. When you have low B vitamins, especially when you also have low omega-3 fatty acids, and you have high homocysteine, which is an amino acid that becomes damaging to the brain when it's elevated. It's also damaging to the heart. When you have those conditions, you get brain shrinkage, and you're much more likely to drift into qualifying for an Alzheimer's diagnosis. We've known for a long time that magnesium is essential for brain health and heart health because they're both electrically active organs. We've known for a long time that reproductive hormones like testosterone and our various estrogens and progesterone and other hormones like pregnenolone and DHEA and growth hormone are important for brain health. And again, one of the reasons that women are at greater risk for Alzheimer's disease than men is because they go through menopause and they have more hormonal complexities. And the longer you live without the nourishing support of some of those hormones, the more the signaling to this receptor in the brain is, hey, we're in trouble, we've got to downsize. And the balance tips. So when it comes to trying to level things out and making sure that our brain is healthy, that we're making brain cells at least with the rate that we might lose some, how do we do that? Well, it requires addressing everything that goes in that counterbalancing basket. And you can't deal with one thing. You can't have good levels of acetylcholine and expect everything to be fixed when you're completely deficient in a lot of other things. It's kind of like if your bowl of minestrone soup is down to nothing but broth, just adding in some kidney beans doesn't get you back to having minestrone soup. You've got to measure all the ingredients and decide, what am I missing if what I want is minestrone soup? So Dr. Bredesen's research and our research and work at A Mind for All Seasons has largely centered on measuring nutrients and hormones and calming inflammation, and looking at all the various factors necessary for the brain to be in a healthy state. Dr. Bredesen published a paper on that in 2014 called Reversal of Cognitive Decline, Novel Therapeutic Program, where he talked about this multimodal approach. He did another follow-up study with 10 patients. Then he published this paper on 100 patients. And when he did that, he basically laid the groundwork for a lot of different people throughout the world to say, maybe fixing Alzheimer's disease, or at least influencing the trajectory of the disease, is less about one thing. It's not about patching one hole in the roof. It's more about programmatics. It's about a multimodal approach. It's about putting as many counterbalancing factors as you can on the opposite side of the equation. Now, we have done that at A Mind for All Seasons for years now, and we have many, many hundreds of clients that we've written treatment summaries for and done very extensive blood work in. And if you go back and watch the other session that I did, I talk about a few of the case histories and some of the impressive things that we've seen. Here's where brain injury comes in. Now that we've set the stage, I want to tell you about a call that I had about 2.5 years ago. And this call was from a friend of mine who lives here in the Boise, Idaho area. And he has watched A Mind for All Seasons grow and impact the lives of people with dementia. But he was calling for a very different reason. He was calling because he had a daughter who was 19 years old. And he tearfully let me know that not too many months before that, while traveling abroad with some family members, she was found standing on top of a 14-story building, ready to take her life. Terribly tragic situation, just absolutely devastating. And this friend called and he said, I don't know if you can help, but I feel like I need to call you. I'm hopeful that you might be able to do something for my daughter. And his premise was, if you can help people with Alzheimer's disease do a little bit better, if you can help people with brain fog totally clear that fog, if you can help people with a mild cognitive impairment diagnosis improve to the point that they have normal cognitive scores, like 30 out of 30 on a standard Montreal cognitive assessment, if you can do that, then maybe you could help my daughter's brain heal. Maybe you could help her feel better. Maybe you could help her get past what she's dealing with as far as suicidality and major depression. And he went on to explain that for years, she had been very depressed and she had been locking herself in a room with the lights turned off. This was a talented, really smart girl, straight A student, really good as a musician, wonderful athlete. And I said, I can't promise you anything, but I will do everything that I can for your daughter. Our whole team will work as hard as we possibly can for your daughter. We don't have anything to lose. And theoretically, if we do the things that help the brain be healthy, she might show some improvement. She might heal a little bit. Well, fast forward to the present time. I'm still in contact with her. Her cognitive scores have improved substantially, but more importantly, she's off lithium, which was there because she had a bipolar disorder. She's still on a very low dose of an antidepressant medication, Zoloft. But more than anything, what she does is she has dealt with a genetic tendency that made it hard for her to use B vitamins. She does some things that help calm the inflammatory response long term. And she's taken care of some hormonal signaling problems. The root cause of those problems was two things: genetics, and she had had multiple concussive injuries. I mentioned that she was a good athlete. Well, she loved to play ultimate frisbee, and she had had more than one collision with other people. And she loved to play rugby. And it's a very concussive sport. And she had multiple concussive injuries. The problem is, she hadn't really been fully knocked out more than just one time. And that one time was like, oh, she's out for a few seconds, kind of saw stars, came to, and nobody treated it very seriously. But working with her and seeing some results has caused us, especially Randy, our medical director, to go out and get advanced training. Now, Randy had trained with Dr. Bredesen directly. He was one of the first providers in the world to go off and get training with Dr. Bredesen. And that was after doing a lot of research into his papers and digging through footnotes and trying a whole bunch of stuff himself. If anybody knows Randy, you know he's like a dog with a bone. And if he gets an idea, he does not give up on it. He will research the thing until he feels like he's dug as deep as he could possibly go. So he did the same thing when it comes to brain injury. And he contacted Dr. Mark Gordon, who had been popping up on various podcasts and interviews, partly because he was the subject of an award-winning documentary called Quiet Explosions, where he talked about 30 years of working with the US military, and to a lesser extent with football players, trying to understand what constitutes a brain injury. And what Dr. Gordon found is that we don't consider brain injuries as thoroughly as we should. I'm going to give you the quick and dirty version, and then we're going to dig a little bit into the science of it. And then we're going to talk about any questions or thoughts that you might have along the way. And particularly as we wrap up, I'll leave some time for a little bit of discussion to make sure that we've covered all the points as thoroughly as possible. So here's the quick and dirty version. What is it that we learned in digging into Dr. Gordon's research, and what does postdoctoral work in neuroendocrinology show? What it shows is that the brain doesn't just sit in the skull, it floats in the skull. And it doesn't take a tremendous amount of force for the brain to compress on itself and damage the pituitary gland. Now, the pituitary gland controls signaling for at least 35 very neurologically active hormones. So if you have damage to the pituitary gland, it does two things. It ignites a chronic inflammatory response, so the immune system just sort of gets revved up chronically, and it goofs up signaling for a lot of very neurologically active hormones. So now that we understand that, and we have applied that for better part of a year and have done additional lab work beyond what we normally do with dementia patients, what we have seen is that almost everybody with a brain injury ends up with a lot of hormonal goofiness and a lot of inflammatory markers that are really elevated. And we've also seen that when you calm the inflammation and you fix the pituitary hormonal signaling, people do better. Oftentimes, their depression clears. Oftentimes, they're not suicidal any longer, or their attention deficit disorder clears, or their sleeping disorder clears. We have a lady that enrolled in our program, gosh, it's been like 3.5 months ago. And one of the first things she told me when she enrolled is, I have spent decades of my life trying to sleep well. And as it is, at best, I sleep 4 to 5 hours a night. And she understands that if you sleep less than 7 hours a night, you're at much greater risk for cognitive problems later in life. And you drag through the day anyway. And she did not feel good. And she said, if you can just help me sleep, I will be forever grateful. Well, fixing a lot of this hormonal signaling is what it takes. And she's now sleeping, and she's so excited. And we're so excited because she has spent way too many years in a devastating situation, and we can do something about that. So here's a common scenario, and maybe you can relate with this, and then let's dig into what some of these issues do to affect different parts of the brain. Imagine that you're sitting at a traffic light and you're stopped completely. And before you can hardly tell what's going on, you hear a squealing of brakes, and you look up in the rearview mirror just in time to see somebody tapping the back of you. And thank heavens they were only going 10 or 15 miles an hour. Now, it might be enough to fold your bumper under, probably not even enough to make an airbag go off, but it's likely enough to give you some whiplash. And you might think, well, kind of dodged a bullet there. I'm so glad that they weren't going any faster. Maybe you see a chiropractor, you've got to deal with the insurance stuff. It can be a pain, but it's not much more than a pain in the way that a lot of people look at that. until a few weeks go by and suddenly the person develops an eating disorder or a sleeping disorder, or they start feeling a lot more depressed and they've got a mental health challenge. And when you talk to people and they look in retrospect, sometimes it feels like, wow, first it was the accident, and then the wheels just came off the bus and everything started falling apart after that point. What is missing is that many people haven't made the connection between the two. One of the things that Dr. Mark Gordon found in his research with the US military is that whether you have 10 dimes or a dollar bill, you have the same amount. And when it comes to brain injuries, the same is true. You could jump out of an airplane 10 times, and the concussive force of landing and rolling and just that little jar to the brain could add up. It could be enough to really damage hormonal signaling. If you shoot a big 50 caliber gun over and over and over, those are concussive forces. It might be that you ignite a flashbang in a raid or something, and you get a blast concussion injury. It might be that your convoy is attacked with an improvised explosive device, and you have an injury because of that. But he also found that it could be you have a terribly traumatic experience, and the tremendous stress chemistry that bathes the brain actually does the damage. So sometimes there's a big hit, sometimes there are a bunch of little hits. Sometimes there's one little hit that's done in just the right way that the stalk of the pituitary gland gets damaged just right and it goofs things up. Other times it's a horribly traumatic experience and it does some damage. The end result is that you get a chronic inflammatory response and hormones get goofed up. And then if we dig into specific issues in the brain, we find out things like brainstem damage. Well, when the brainstem isn't working as well, then breathing is harder and swallowing is harder. And you have a harder time perceiving the environment around you and making sense of it. And your movement gets disrupted. We did a balance test for a lady just a few days ago. I reviewed it with her and her family this morning, and she was in the first percentile for balance. So when the brain really gets disrupted, we see it in terms of outward functioning. Coming back to the idea that I shared earlier, that behavior is not just communication. Behavior is an outward manifestation of an inner state. So if all of a sudden you're not as steady, there's something going on internally, and your behavior is communicating that, oh, there's some brainstem dysfunction. The cerebellum is not working as well. There might be some sleeping difficulties. What about the cerebellum, speaking of that? Well, movement gets disrupted. You can't coordinate fine movement. You might have a hard time reaching out, grabbing things. You might not be as rapid in your movements, and that will show up on a cognitive test. Things get slowed down when your cerebellum doesn't work as optimally as it should. In extreme cases, you might not be able to walk. You might end up with what's called cerebellar ataxia. It's like the Parkinson's shuffle, where you see someone kind of plodding down the hallway and struggling to move, and turning is difficult because they shuffle. And there might be tremors or dizziness or slurred speech. We see a lot of damage to the temporal lobe, and that shows up with people that don't recognize faces anymore, or they struggle with the spoken word, or they don't understand an object that they're looking at. They're thinking of one thing and they're using the wrong label for something different. There can be alterations in a person's sexual behavior. Sometimes people become hypersexual. There may be an inability to categorize things, or persistent talking if the right temporal lobe is really damaged. They might be increasingly aggressive. That's why in frontotemporal degeneration, which is a collection of different kinds of problems that sort of fall under that FTD umbrella, we sometimes see these kinds of extreme things. People that talk a lot and they have no social filter, and they will yell highly suggestive, sexually oriented things across a crowded restaurant. They think somebody's attractive across the room, and everybody in the restaurant is just about to find out. The occipital lobe controls vision, and there can be a lot of damage to that. Various problems with color or visual acuity or seeing things that aren't there. having hallucinations or illusions, or reading things and having certain words dropping out, or not recognizing certain objects when they're drawn. If there's parietal lobe damage, it may be difficult to focus on more than one thing at a time. Talk about it gets hard to drive. Oh, if your parietal lobe is not working very well, you can really struggle being out trying to manage all the different things. Better hope that your airline pilot doesn't have parietal lobe damage, or you're in serious trouble. You may have trouble naming an object, or locating the words for writing, or struggling to draw an object. Think about a clock drawing test, or copying overlapping pentagons, or copying a cube, some of the things that show up on standard cognitive tests for some of you professionals that are on this call. Those things are affected by the parietal lobe. Trouble with math or focusing, our visual attention, or hand-eye coordination kinds of things. All of these issues come out when there's parietal lobe damage. A lot of people are familiar with frontal lobe damage because when it's there, people are really hard to deal with. This again comes back to the idea of frontotemporal degeneration. The frontal lobe allows us to change gears. It allows us to think and plan and reason and use good judgment. It allows us to shift from one line of thinking to another. And when people have frontal lobe damage, they repeat and repeat and repeat and repeat, and they go over and over and over. They might fold the same piece of paper over and over. They might ask you the same question over and over and over because they can't shift gears very well. They have a hard time staying focused on a task, except a task that they can't get off of because they're on repeat mode. There's a lot of changes in social behavior and personality, and even the ability to express themselves with language. Now, when you consider all of those changes in the brain and the various things that could cause those changes, high on the list with causes of those sorts of changes would be various dementing illnesses. So Alzheimer's disease is the most common form of dementia. And you also have Parkinson's and Lewy body that are kind of two sides of the same coin. That's extremely common. Vascular related issues, also very common. And frontotemporal degeneration as a syndrome represents a lot of cases. Those few sorts of dementia that I just named are by far the most common neurodegenerative diseases. But what about brain injury? Don't brain injuries show up with a lot of those same kinds of things? They do. And when you think of what also shows up in what's classically labeled post-traumatic stress disorder, and you compare it with what shows up in traumatic brain injury, you find out that they're the same thing. Now think about soldiers and the characteristic ways that we look at post-traumatic stress disorder. We look at people that have gone to war, or they've been in the military and they've seen some tough things, and they come back, and if a car backfires, bam, they hit the deck and they're terrified that they're being shot at. Or they have a horrific dream and they end up holding their spouse at knife point because they're in a dream state, and their spouse is terrified because all of a sudden they become the enemy in the minds of their once loving husband that's gone off the rails after being out serving the Gulf War or something like that. That's often how we think about PTSD. Dr. Gordon found that post-traumatic stress disorder is actually late-stage brain injury. When you have a brain injury, you have the same kinds of things that show up in PTSD. There's fatigue, there's insomnia, there's impaired memory, trouble with concentration. You can read the list here. Lots of different things that are related to both conditions. So they're basically two ways of looking at the same thing. Isn't it interesting to see the kinds of overlap that you have with dementing illnesses as well? Most people with dementia are chronically fatigued, or they show impaired memory, or they have insomnia, or all of the above. Definitely difficulty in concentration. Depression is really common. In fact, we have to rule out depression before we can say that someone has dementia, because they just kind of overlap. Irritability, anger, emotional distress, changes in libido, all of the things here on the list are also related to dementing illnesses. Now, just as there are measurable biomarkers of Alzheimer's disease, I showed you that slide where Dr. Bredesen said the perfect Alzheimer's drug would have to do all of this stuff. there are actually also measurable biomarkers of traumatic brain injury. And I'm not going to get into the deep science of all of these specific different things, but I give you the slide so that you have the ability to see, oh yeah, there are characteristic things that show up when there's a brain injury. There are basically two phases to head trauma. Phase one deals with the physical trauma, usually caused by some sort of mechanical force. And you've got immediate bruising and swelling. If we're thinking about a really serious head injury, then there's some kind of a penetration. And there can also be damage from things like radiation, chemotherapy, general anesthesia, radiation, those sorts of things constitute a type of brain injury. You see the same inflammatory markers that get elevated in those situations that you see in things like heavy metal toxicity, or if somebody has major issues with industrial pollutants in their system, or herbicides and pesticides and plastics. You see similar things that you get when there's an actual physical force to the brain. Phase two is that you get this sort of smoldering inflammatory response, and it can cycle for years. So even though you're past the acute phase of things, you get a chronic inflammatory response. It's like, well, I guess to give you an example, think of two countries, and you go visit one country and you've got a uniformed police force. They're the men and women in blue, you might say, and they drive around patrolling the streets just like the police do in Boise and Idaho and other parts of the country. And so you go to that one country and there's a uniformed police force that has a good presence. You see them routinely stopping people for traffic violations. You recognize that if there's a problem and you need help, let's say you see a suspicious vehicle out in front of your house and you're kind of nervous about it. And in that country that you visit, you know that, hey, just like in our country, you can call the police force and they will show up and they will handle the problem. Compare that to a country where you go to visit and there are Jeeps driving around that have huge machine guns mounted on those Jeeps and uniformed soldiers on the backs of them driving around, and they're in their battle fatigues and they've got machine guns slung across their backs. And when government officials come out, they're surrounded by the military. If you think about those two countries, which country do you feel safer in? I think most people would argue they feel a lot safer in the country where the men and women in blue just regularly patrol the streets and they take care of things. The same is true when it comes to our brains. Our brains and our bodies have a sort of frontline police force. And if things are working really well and we're exposed to a virus or bacteria or something, our frontline security forces rev up and they take care of it and we get better. But sometimes things go terribly wrong and the military gets called in. And we get this chronic inflammatory response where basically the military now is there in the land all the time, constantly on patrol. They're at high alert for anything that might be going on. In other words, our immune system is just chronically revved up, which is why you see things like reports out of the NFL that the league's former players have much higher rates of Alzheimer's disease and chronic traumatic encephalopathy and other dementing kinds of situations. They have that much more than the average population. A rate of 19 times the normal rate for men ages 30 through 49. It's not normal to have dementia at all if you're 30 to 49. It shouldn't be normal for anybody, but it certainly is not very common. But in football players, it comes up with some regularity, and it doesn't seem like we go more than a few months before there's a reminder of that. Some NFL player, unfortunately, will take his life because he's got a brain injury and is suffering from the consequences of that. So what happens with the pituitary gland? I talked earlier about pituitary signaling gets goofed up. And when we see that, what happens is that we get some acute symptoms within the first 3 months, and then we have chronic symptoms. When it comes to hormonal deficits, 56% of people that have had a brain injury within the first 3 months show hormonal deficits if you measure them in blood work. And 32% of those are gonadotrophic. That has to do with sex hormones. And our steroid hormones show up in 19% of those people. 9% will have issues with hormones related to circadian rhythms and sleep. And 8% have some thyroid dysfunction. For people that have long haul kinds of issues, they've got a brain injury, and then for years, they're just never the same. That's like the beginning of when their dysfunction started. You see chronic issues long-term in 36% of those people. And a lot of that has to do with sex hormones. So you see over on the right, chronic symptoms that show up. We get things like fatigue, depression, anxiety, insomnia, brain fog, even dementia. When you have chronic fatigue, that's a risk factor for dementia. When you have depression and anxiety, people with depression and anxiety have higher rates of dementia. Why is that? I think a lot of it is that they may have depression and anxiety because they have hormonal signaling problems. Their pituitary gland isn't working the way that it should. I'm not suggesting that we shouldn't treat those things with antidepressant medication. And I'm not giving specific medical advice to anybody. I think this warrants, just like Dee gave the disclaimer at the beginning, don't take any of this advice and do something about it without consulting with a qualified provider and really dig into it and find out about your specific situation. But I do think that we should pose the question, could it be that antidepressants that are there to influence things like serotonin in our bodies are maybe treating more symptoms? But if we focus on hormonal signaling and we get to root causes, maybe we could have durable, lasting improvement. Well, I'm not totally guessing because we've done this now in a lot of people in our offices. And that's what we see. We see that many people improve when we fix those types of hormones. So think about how complex the whole hormonal system is. You have the pituitary gland that's sending signals to the hypothalamus and to the thyroid and to the adrenal glands and to the pancreas and to the gonads. And so damage to that very, very delicate pituitary gland that's right in the middle of the brain that can be compressed on so easily can affect a lot of different things. So what do we see in the blood work? Well, in people that show up with weakness and fatigue and they have a hard time exercising, very often there's decreased adrenocorticotropic hormone or ACTH, growth hormone levels are depleted, luteinizing hormone and follicle stimulating hormone and thyroid stimulating hormone are all diminished. When people have weight gain, think of depression. A lot of times people gain weight in depression. That's a symptom of depression. Could it be that the root cause for at least some of those people is that growth hormone, luteinizing hormone, and follicle stimulating hormone are messed up? There are two main reasons that people gain weight: diet and hormones. Physical activity or lack thereof will affect things a little bit because weight training especially will improve our ability to use sugar and to store it as glycogen in the muscles. But by far, the biggest things that influence weight are how we eat, because that influences the hormone insulin, and that's our growth, our hormone of growth and storage, and other hormones. Those things have the biggest effect. I'm not going to read through this whole list, but I think it's really interesting to look at the various signs of pituitary dysfunction that show up in some of these conditions. If your learning and attention aren't great, could it be a growth hormone deficiency and a thyroid that's not working as optimally as it should? Well, speaking of optimal, there's a big difference in normal versus optimal. So the normal range is what we get when we take 100 people and we test them on a certain lab, and we throw out the top 2.5% of the scores and the bottom 2.5% of the scores. That leaves 95%, that's the normal range. Now, that is going to be heavily affected by the health of the population. And I saw this in a pretty powerful way recently. I have a client who is a psychiatrist in New Mexico, and she has a history of dementia, and she's showing symptoms of brain fog. She's still a practicing medical doctor, a psychiatrist, but she's having some decline, and she wants to do something about that early on. So she became a client of a Mind for All Seasons. And I have another client who now lives in the Boise area, but she lived in New Mexico previous to that. What's interesting about that is that in both cases, I have access to lab work that was done in New Mexico. And when I look at the range on liver function tests for people in New Mexico, my client that's now here in Boise had a particularly interesting situation because she had a checkup every year for 5 years. And it was only in her last checkup that her doctor said, "Whoa, your liver is not doing well. You're in serious trouble." And she said, when I go back and I look at those liver function tests, they were climbing every single year. Why didn't my doctor see it earlier? Well, there's two reasons. Number one, doctor wasn't looking historically, but more importantly, when she lived in New Mexico, the population there is not as healthy when it comes to liver functioning. There are a lot more Native Americans, and unfortunately, many of them have problems with alcoholism. Many people in that general area of New Mexico where this lady had lived have enough problems with alcoholism that their liver function tests are worse, which means the normal range is different than the normal range in Boise, Idaho. So in New Mexico, her labs were considered normal, and in Boise, they were dysfunctional. And it was simply driven by the health of the population. Now, not every lab compares to a local population, but it's something to keep in mind. What population are we measuring against? Now, in school, everybody knows that a C- is different than an A+, but that's a normal range. When it comes to labs, we don't care as much whether a person is getting a C-. We want people to get an A+. You feel differently when you do. Consider what it would be like if I lost a shoe and I borrowed one from you. And let's say that I wear a 10 to a 10.5. And let's say that you had a shoe that was an 8.5 or a 9. And I put it on my left foot and I walked around all day. I had a size 10 shoe on my right foot and a size 9.5 on the left, or a 9. And let's say my toes were cramped and it just didn't feel right. And so I went to the store to buy a shoe and I talked to the associate there and I said, "Man, this shoe just doesn't feel right." Can you imagine how you'd feel if that shoe clerk said, "Hey, let me have a look at that. Let's measure that." And he or she came back and said, "I don't know what to tell you. It's a 9. That's a normal shoe size. It should work fine for you." When it comes to any lab values, the question is not whether you're normal, it's are you optimal? And more specifically, is it optimal for you? Labs should confirm a diagnosis as much as helping a provider make one. So if your thyroid stimulating hormone is 3.0, which is still considered in the normal range, but your hair's falling out, you're freezing cold all the time, you've got brain fog and you have no energy and you can hardly get out of bed, you have a thyroid problem. Optimal would be more like 2.0, 0.4, 0.6 up to 2.0. That would be more optimal for brain functioning. And so if you're at 3.0, you got a problem. When it comes to cholesterol, same thing. We need to have optimal cholesterol levels. And for the sake of time, we're not going to dig too much into some of the ins and outs of cholesterol unless you want to in the Q&A. But I will say that 50% of people in the hospital with their first heart attack or stroke have totally normal levels of cholesterol, either because they're taking medication or that's just the number that's there. And when you dig into the research, you find that people are at greater risk from cholesterol that's too low than a total cholesterol that's too high. That is because cholesterol itself is a building block of all of our hormones. It's an essential building block of a lot of the brain. Much of the brain is a great big ball of cholesterol, and we've demonized it. The thing that causes heart attacks and strokes is not cholesterol, it's damaged cholesterol, small, dense, oxidized cholesterol particles. And the thing that drives that is sugar. So we need to be thoughtful about what we're eating. In fact, the best predictor of heart attack and stroke risk is your A1C, your average sugar over time. Unfortunately, unless you're a diabetic, most doctors don't check that in a checkup. They look at fasting glucose, which only tells you whether or not your body's making enough insulin to get the job done. It doesn't tell you how insulin resistant you might be. Looking at fasting insulin and A1C would get you further, and it would teach a lot about the cholesterol panel. So we can come back to that if anybody wants to. It's important to recognize that we can optimize neuroplasticity. There is a lot of mounting evidence, and the last 10 years have been pretty game-changing to show that the brain is much more plastic than we thought that it was. It can shift, it can change, it can grow. There's a lot that can regenerate. And improving the environment that allows the brain to heal is critical. If we have sufficient hormones, if we have growth factors that are necessary, and if we're calming the inflammatory response, the brain can undergo a lot of healing, even sometimes decades after there was damage. Optimizing thyroid is essential because thyroid is involved not just in our energy level, but thyroid is critical for brain functioning overall and for memory and concentration and our ability for signals to transfer throughout the brain. Sex hormones are like memory. Testosterone is memory for men and women. And estrogen, especially estradiol, is particularly important for memory functioning. Progesterone is critical for sleep. Many people with PTSD and other symptoms of brain injury end up with psychotropic medications. They have psychotic breaks in cases. And I'm, again, not suggesting that somebody should go off those medications. There's a role for those medications. It's a good thing that scientists have worked really hard to come up with interventions that really do make a difference for many people. But I do find it interesting that progesterone, which is important for both men and women, albeit in different amounts, binds to GABA receptors. And so it's calming. One of the most phenomenal things on the planet for helping people sleep better is progesterone. I talked to a lady just yesterday in Texas, one of our remote clients down there. She has struggled to sleep for years. And she said, I love my progesterone. Just a little bit of progesterone was the answer in helping her sleep and clearing up some of her brain fog. And progesterone is also very good at lowering certain inflammatory markers. You see interleukin-1 beta down here on the screen, tumor necrosis factor alpha. Those are inflammatory markers. And if you've been following the situation with the COVID pandemic, you may have heard of some of those things. You hear about interleukins, like interleukin-6 shows up a lot. That's part of the immune response going on in COVID. Tumor necrosis factor alpha shows up in COVID. And progesterone can be calming to those. So what do we see if we sum up some of where we are at this point in our understanding? We see that more than 80% of what actually constitutes a brain injury are mild cases. I cannot tell you how many times I've had people come into the office with no history of being diagnosed with a concussion, all sorts of symptoms of a brain injury. And we're talking young people, teenagers in some of these cases. And we do an eye tracking test with them. You know how if you hit your head, the doctor will say, follow my finger. Well, that test, back and forth horizontally, is called horizontal smooth pursuits. We have a machine in our office that tracks eye movement 100 times a second with a laser. You can see a lot more than the human eye can see looking at another eye. And we don't just go back and forth smoothly. We go up and down. We go in a circle. We go back and forth rapidly, up and down rapidly, and have some other tests that we do. And it gives us a really pretty comprehensive look at how the neurological functioning is showing up in terms of eye tracking. Eye tracking is the outward manifestation of what's going on inwardly. And I have a lot of people who come in that we do an eye tracking test with, and their eye tracking is a mess, completely goofed up. And we look at it and say, you've had a brain injury. And I have literally had cases where people said, I've never had a concussion. I don't know. And I'll start digging into their athletic history. I had a teenage girl not too long ago that said, no, I've never had a concussion, never been knocked out. And I said, well, have you played any sports? Oh yeah, I played rugby. Oh, okay. Have you ever been hit so hard that you saw stars? And her answer was, pretty much every game. Doesn't everybody have that? But she didn't equate that with a brain injury. It wasn't until we looked at her eye tracking that showed up. And actually her dad, who's an ER doc here in the Boise area, was kind of ticked off that it hadn't been diagnosed before then, that it had been missed because she had serious mental health problems. And now we knew that was related to an untreated brain injury. So 80% of the time, these things are mild. There's no loss of consciousness, and they have normal Glasgow coma scores. Chronic symptoms of traumatic brain injury are often mistaken for mental health issues like depression, anxiety, insomnia, brain fog, and so forth. A lot of kids have attention deficits because they've had a brain injury. I have a 9-year-old client right now who flipped off her bicycle about 1.5 years ago, had a major hit to the face. She was wearing a helmet, but if your face is what hits the ground, the helmet only does so much. And she was not the same after that. She couldn't focus in school, couldn't pay as much attention. Things were not going very well for her. And she was much more anxious and nervous. She was checking all the doors around the house every time the family would leave. How many 9-year-olds do you know that go around and double check all of the locks on all the doors and windows because they're anxious? This girl was doing things like that. And when we calmed the inflammatory response and started helping her body heal from this, those symptoms went away. We see a lot of issues on neuroimaging, where doing scans are not good predictors of the late effects of traumatic brain injury. If you do a lot of brain scans, those scans come back and say, you're pretty normal. It's in the hormonal signaling that you see the markers. And those deficiencies can occur within 3 months. They can often become chronic after 12 months. Using psychotropic medications might mask the symptoms, but it fails to address the underlying root cause, which is why so many soldiers or so many people that have been in accidents, so many people with chronic mental health problems struggle for years. They try one medication and it seems to work a little bit, and then it kind of quits working, and then they cycle to another medication, and they're in and out of the VA system, they're in and out of the mental health system, and struggling chronically without really having sustained success, because in a lot of those cases, we're probably not addressing the root cause issues. And when you are replacing hormones, it's important to treat hormones like different buckets, if you will. There's a cascade for how our hormones are built. Every hormone starts out as cholesterol, which is one reason that you have to have enough good, healthy cholesterol. So cholesterol first becomes pregnenolone, considered the mother of all hormones, the master hormone in the brain. And then pregnenolone becomes DHEA, and DHEA goes down one pathway and becomes stress hormones. And it goes down another pathway and becomes reproductive hormones. It's a little bit of an oversimplification, but there's a cascade effect here. So think about each one of those hormones as a little bucket. If you've got high levels of one hormone, but you're super depleted everywhere else, and hormones are built by turning one into the next and into the next, then there's a whole lot of robbing Peter to pay Paul that can go on. So helping people do better is more a factor of measuring all those different hormones and replacing them and filling up all those buckets so we quit robbing Peter to pay Paul. Now, I've alluded a little bit to some of the things that show up in COVID, and I wanted to have just a few slides here and then we'll have some discussion. When it comes to long-haul COVID, more and more, some providers that deal in that space are looking at it as a type of brain injury. Because when you look at the inflammatory markers that are ignited with COVID, And when you look at the hormonal signaling that gets messed up, it's the same stuff. And theoretically, doing similar kinds of things could help a significant number of people. So that's something to think about. Common neurological symptoms of long-haul COVID are PTSD and impaired memory. You've heard of sort of the COVID long-haul brain fog. Poor concentration goes right with that. Anxiety and depression. And when these things cycle for months, then we call it long-haul COVID if somebody had COVID. But when we dig into some of the markers related to it, is it just a type of brain injury? Well, figuring all this out is not a matter of doing one thing. It's a matter of being aware of many different things that affect brain health. When we can plug as many holes in the boat or in the roof as possible, that's when we have the greatest chance for success when it comes to brain health. Now, if you want to know more about some of these things, you might look up the movie Quiet Explosions. It won some awards as a documentary. Jerry Sher, that you see on this interview with Montel Williams, is the producer of that film. And interestingly, her husband, when she was filming the movie, she had this sort of offset interview after hours with Dr. Gordon, who you see on the right. And they were talking about how she's personally invested in this movie about people with brain injuries because her husband had kind of a brain injury a couple of decades earlier, and it has really affected their lives. Her kids were terrified that they were going to lose their dad. And he was still around, but he was not nearly as functional. And here they are sitting around the fire talking about this after work, filming this documentary. And Dr. Gordon said, I could help your husband. I'm sure we could help him make some improvements. I don't know how much, but I think we could do that. And Jerry Sher was like, are you kidding me? It's been 20 years. How do you do that? And he said, the brain can still heal if the conditions are right, but the conditions haven't been right for your husband. Why don't we do that? Well, he had such an amazing improvement. He became part of the documentary. So it might be an interesting documentary to check out, or even check out this interview with Montel Williams, where Dr. Gordon talks about some of his work. One of the things that Dr. Gordon pointed out when it comes to COVID-19 is, I've underlined it here, this is the non-traumatic form of brain injury. Notice non-traumatic, there's no blunt force trauma, but it's precipitated by a viral infection that induces a massive release of inflammatory cytokines referred to as a cytokine storm or autoimmune encephalitis. So you get swelling in the brain because you get these inflammatory cytokines, part of the immune system, and they just don't calm down. The military moves in and starts occupying the country instead of the regular police force. And until you get the military to the point that, okay, they can withdraw into the background and the men and women in blue can come back out, things are a problem. So we also see that COVID-19 relates in all sorts of things affecting the brain that are suggestive of chronic inflammation. So the mechanisms of damage are the immune system is compromised, you get damage to the blood-brain barrier from all that cytokine storming, you get a lot of reactive oxygen species. And I'll give you some of these slides as far as, if you want some of the particulars, you can dig into this. Some of you may want to pull these threads, and others of you are like, just cut to the chase. Tell me what to do to feel a little bit better or help people that I'm serving. So I'll try to balance that just a little bit. Basically, treatment is calm the inflammatory response. So we're going to do that with everything from high dose antioxidants that are very anti-inflammatory, things like N-acetylcysteine and liposomal glutathione, but also reducing inflammatory foods and beverages and controlling sugar and using oxygen to help calm the inflammatory response. Exercise with oxygen can be very helpful. Can't say much for the guy in the picture there, but it looks like he believes in exercise with oxygen. And I personally can vouch for the value of exercise with oxygen. I had an interesting experience with a family member who had COVID. Fully vaccinated, but then developed COVID in one of the later variants that wasn't as responsive to the vaccines. And she was not doing very well. She had struggled for a good week. She had run 102+ degree fever for a week and just felt totally crummy. And this was back when she had a strain that was likely to be responsive to monoclonal antibodies, but she couldn't get into the hospital fast enough to just start feeling better. And so I finally talked to her and said, look, we can't goof around with this. I'm going to mask up and I'm going to come into the office after hours when nobody else is around. And I want you to come down to the office and we're going to put you on our bike and we're going to do exercise with oxygen. If you're not familiar with that, we fill a great big bag, this bag that you see back there, with 85 to 90% oxygen-rich air. So instead of air that's 26% oxygen like regular room air, this is highly concentrated oxygen. And so we're going to put a mask on your face, I told this family member, and you're just going to sit on the bike and you're going to move at a pace as if you're walking. You're not even going to really pedal and truly exercise. We just want your blood to circulate. And you're going to breathe in that 85% oxygen and you're going to hold your breath and force it through. Here's why. In the lungs, we have the alveoli, these little air sacs. And we breathe in air that has some oxygen, and then that oxygen transfers across a membrane into the blood. But when you have a bunch of mucus built up, then it's really hard for the oxygen to get through the mucus and across the membrane and then into the bloodstream. That's why upper respiratory infections take a long time to heal. So I had this family member come in after hours and she would wear the mask, and for 15 minutes, she just breathed the oxygen and she would kind of bear down on it and hold it to try to force that oxygen through the mucous membrane so that we could get plenty of oxygen to our bloodstream so that our immune system could work the way that it should. And I hadn't done this with anyone else. Randy had done it at his clinic down in Pocatello. And he had shared that at a Friday lunch and learn meeting with our team. And I thought, I'm going to do that. That's helpful. Theoretically, that could work. So after 15 minutes with this family member, she got done and she was getting ready to leave. And she was standing over by the door. And there I was about 15 feet away at a distance. But even at that distance, I could tell she was starting to sweat. And she said, I don't feel so good. Like, I'm really starting to sweat. I'm really hot all of a sudden. And I said, your fever just broke. And she said, nah, are you kidding me? And I said, I bet it did. Why don't you call me tomorrow evening and tell me how you do? Well, she called the next day and she sounded like herself again, dramatically recovered. And she said, that was my fever breaking. That's it. I mean, I haven't looked back. She said, my Fitbit gave me a 94% on my sleep. And I'd been in the mid 70s to low 80s for a couple of weeks. I have not been sleeping well. I slept phenomenally well. And the reason why? She got more oxygen. So we can do things like that that help people heal from some of these situations. Well, at the end of the day, I think the same thing that I would say about Alzheimer's disease, which is it's time for a different approach. Instead of looking for one variable that we can change or the magic pill, I believe that it's time to look at all the different factors and recognize the human system is just flat complicated. There are so many different variables that instead of trying one variable against placebo and hoping for an effect, we've found in Alzheimer's disease, you get a lot further when you use a multimodal approach. And we've also found in brain injury, the same is true. But when you look at a brain injury from a different perspective, when you look at it as an inflammatory response and a hormonal signaling problem, it leads to different kinds of root cause types of solutions. So I emphasize again, instead of just doing one thing when it comes to brain health, let's do everything that we possibly can. And let's keep learning and researching and figuring out what we can learn that will give us clues as to how to help people do better. With that, I want to open it up to any discussion that we might have and see what thoughts or questions. And Dee and Dara, maybe you can help me out. Are our participants able to unmute and speak, or are they only able to talk in the chat?
No, they can unmute and speak.
Okay.
Yes.
Wonderful.
What a wonderful presentation, Eric. I mean, my goodness, this is like turning theory on its head here about what can and can't be done with the concussion and healing the brain.
Thank you. I think that often we're slow to see changes come about. For example, from the time that research studies very compellingly showed that folic acid, vitamin B9, was critical to preventing neural tube defects in developing fetuses, and women were prescribed a prenatal vitamin with high doses of folate in it. From the time the research was really good until the time that became standard practice was about 30 years. And on average, from the time a new treatment intervention comes out until it's standard practice, on average, and we're talking with one treatment, not multimodal stuff, on average it's 17 years. And we're talking about research that's been going on in some of these segments for decades, but it takes a long time for this stuff to come together. I'll give you a quick example of that. I had a chance conversation with a lady that works as a physical therapist with the STAR system at St. Al's here in the Boise area. And she was expressing frustration when she was talking about what we do at A Mind for All Seasons for brain injury. She was expressing frustration with ER doctors in their own hospital system. And she said, Eric, does it drive you crazy that ER docs very frequently still tell people that show up with a concussive injury to go home and sit in a dark room and don't do anything that's stimulating for about 2 weeks? And I said, yeah, it drives me crazy. And she said, Eric, I learned in physical therapy school that the research has not supported that for a long, long time. Why is it that ER doctors still tell people to do that, especially the older docs? Because that's what they were told before. And I don't know what it is. There are lots of factors when it comes to human nature that affect our ability to create change, but we still have a healthcare system where a kid will be involved in a football game or something and get his bell rung and go to the emergency department. He's told to go home and skip school for a week and sit in a dark room and don't do anything. And they don't do very well. And then we wonder why some of these teens have such high rates of suicide. I wouldn't pretend that brain injury is the only factor, but it's a contributing factor. And if we can make a change for people with those brain injuries, shouldn't we do that?
And a pretty big one.
Yeah.
So a question for you, what do you think can be done to accelerate that rate of change? I mean, aside from education, which is the first step, getting people to be aware, what are you doing? What can individuals do in raising questions with their doctors? How do we help, like, move this forward? Any thoughts?
Yeah, I do have a few thoughts. I lay awake at night thinking of this. Actually, I don't. I sleep really well, but when I wake up, I think about it. But I think when you look at how things have changed over time, you find that in any industry, in any new line of thinking, there comes a tipping point that occurs. Malcolm Gladwell writes about a tipping point where you have the innovators, and then you have early adopters, and you have the early majority and the late majority, and you have your laggards. And just because someone is a medical doctor or a medical researcher doesn't mean that they aren't human and subject to human tendencies. And it is the human tendency to preserve the status quo. So I think part of what happens is that we have to accelerate the rate of innovation so that we can accelerate the rate that we have more early adopters that will then attract the early majority. And I believe that's exactly what's happening. A Mind for All Seasons is not the only company doing this kind of work, but those that are truly innovating the fastest have some things in common. One is that very often it's a private pay kind of scenario. And that's unfortunate in some level, but insurance companies tend to look for something that has a long, long history of proven effectiveness, especially when there's a medication that can be prescribed because then it's easier to track. And there are a whole lot of institutional norms that give a reason to use those types of interventions. And I'm not being critical of that. I think medications have changed a lot of lives and have saved billions of lives when it comes down to it. I'm really grateful for things like antibiotics, for example. But if the only thing that we do in healthcare is to wait for the insurance company to approve something, or to wait until there are massive, large-scale studies funded with tons and tons of dollars that is required to fund studies on millions of people, then we're going to be waiting probably forever for studies on certain things. You're not going to find research on certain vitamin interventions at any particular high level because it costs millions of dollars. And if the end result is that you take a $30 supplement that you can get over the counter, there's no incentive for it. So part of what allows for innovation is doing things on a private pay basis that are as affordable as possible, but you take a population that is sick and tired of being sick and tired, and you couple that with people that have good scientific background and good methods, and they take the approach that if something is promising, if there's a mechanism of action that makes sense scientifically, if the preliminary research is good, and if the safety profile is extremely good, where there's little to no risk in trying something, where the risk of not intervening is way higher than trying something, well, that's when you innovate very quickly. And the faster you can innovate and get some of those early innovators to influence the early adopters, then the quicker you get to the early majority. And pretty soon, people demand a change. And we're seeing that right now in the healthcare system. In 1 week's time, I've seen 2 different companies pop up nationally. And I say pop up. They've been there for a little while, but I became aware of 2, one in Canada, one that's here in the US, that are using a multimodal kind of approach to try to improve brain health from one angle or another. And things are rapidly moving in that direction because people are demanding it.
Nice. Nice.
So we do have a question, Dee. Do you see that in the chat, or you want me to?
Go ahead.
So there is a question here. First of all, a comment, lots of great information. Question is, I've heard that Parkinson's disease could be hereditary. Thoughts on any truth to that?
Yeah, I'll tell you exactly what we see in Parkinson's because we've done blood work on a lot of Parkinson's patients and we look at certain genetic tendencies. Almost all, actually, I don't know if I've seen an exception to this, but when we look at apolipoprotein E, APOE, which is related to Alzheimer's disease, the Alzheimer's gene is ApoE4. So on that particular gene, you can have an allele that's a 2 or a 3 or a 4, and you get one from mom and one from dad. So you could be a 2-2, which I've never seen that, would be extremely rare. You could be a 2-3, 3-3, 3-4, 4-4. If you have one copy of the APOE4 allele, then you have elevated Alzheimer's risk because it primes you for inflammation and it primes you for insulin resistance. Virtually everyone that I've ever seen blood work on who has Parkinson's is APOE3-3, which trends toward having a harder time clearing toxins from their body. That also becomes important because Parkinson's disease is a toxicity-related issue. That's why a recent study in Journal of the American Medical Association directly correlated the rise in air pollution in Asian industrial centers with a dramatic increase in Parkinsonism. That happens because of pollution, because pollution depletes glutathione. And when that antioxidant is depleted in your body from dealing with all that oxidative stress, you get neurological damage and it shows up as tremoring and rigidity and other Parkinson's symptoms. We could talk for hours about what we've seen in Parkinson's patients. I had one guy that owned a macadamia farm and he sprayed all of his pesticides, and that's what shows up in his body. I've had clients with mercury and lead levels in the 99th percentile, and they have Parkinson-related disorders. So I would say that there are some genetic tendencies. It often runs in families because people in the same family tend to have similar things like a broken detox pathway. But genetics loads the gun, and your choices and your exposures pull the trigger. So if you're somebody that has family history, but you live in an area that's very clean and you're not exposed to a lot of toxins and those things don't build up, or maybe you're aware of it and you take care of your detox pathway and you intervene early on in life, then you find out it's a lot easier to prepare and prevent than it is to repair and repent. And in my opinion, we shouldn't be waiting until people have Parkinson's disease. We should be testing all these things early. Alzheimer's, Parkinson's, other degenerative conditions start 10 or 20 years before the symptoms show up, and we can measure the factors and intervene before someone has an issue, and we can change the trajectory of aging for people.
So there's another question on the other end of the timeline. So that's preventative. So this question says, are you able to achieve results after someone has suffered from a traumatic brain injury and has had prolonged inflammatory response and hormonal signaling issues at a significant level for more than 20 years? So can you achieve results of improvement when the brain injury occurred 20 plus years ago?
Yeah, that's a great question. And I would say that results are a little bit mixed for multiple reasons. Yes, you can calm the inflammatory response. As long as a person is alive, the body still works to one degree or another. And if you can improve aspects of physical functioning, things can get better. The longer that someone has dealt with it, the harder that is, and the longer it takes for there to be a response. And so it can take a while for the pituitary to really settle down and say, oh, I guess we're serious here. But I have seen in my own work clients that have been dealing with things for 15 or 20 years, and they've had significant improvement. Measurable objective scores, eye tracking that's improving, things like that. Now, that doesn't mean that they improve as fast or as thoroughly as someone who's 20. But you can make a difference. And to the extent that you can make a difference, I think that we should, because every ounce of functioning that we can give somebody is better quality of life, and it's less burden on them in the healthcare system. So I have a client right now who's 100 years old. She actually lives in an assisted living facility that licensed the enhanced protocol from A Mind for All Seasons. And she was a Hoyer lift transfer for 10 years. And she now walks 75 feet with a walker and a one-person assist.
Wow.
Now, she still needs full-time care. We have not cured her. But if you think about quality of life and impact on the healthcare system, staffing rates are improved 100% because now it takes one person instead of two. Her bowels work better because she's up moving around and gravity can do its job. She has dignity again because she can sit on the edge of the bed and participate in getting dressed instead of just laying there like a mannequin that somebody's coming in and manhandling. So I think that there's always an opportunity, always a reason to dig in and try to help someone improve if at all possible.
And I thank you. A great answer. Quality of life. It's all about that. Brooke has a question and she's going to come off mute to ask it.
Hello, Eric.
Hey, Brooke. Good to hear from you.
Yes, I very much enjoyed this. You know, as a parent who's had, well, both my kids I know have had events where they've suffered a concussion, and specifically my daughter, where it required us seeing a sports medicine physician as required to go back to her sport and even to go back to her studies, as you were talking about. So what I'm curious about is, I mean, not that you're giving medical advice, but what are you suggesting parents do, you know, after one of those type of situations where they think their kids have suffered a concussion?
Yeah. Well, the first thing that I would suggest is get in for some eye tracking testing and get a sense of how significant the problem is. And we do free eye tracking testing. Most places will charge anywhere from $75 to $175 to do an eye tracking and a balance test. And we want to save some of these kids' lives. And we do it free of charge as a screener for people so that they can understand where they are at their baseline. So number one, do an eye tracking test and a balance test and try to get a sense of what's going on. And then look at symptoms and try to understand, are we still dealing with some symptoms of a brain injury? And if you are, in kids, it's a little bit tricky because hormones are different in kids. There aren't quite as many established parameters on some of these hormones. So we don't do tons of blood work with the kids. We might check a few things. But we've had durable, sustained improvement with many younger children. I'm talking like under 10 years old. There's a specific micronutrient formula that actually has a lot of good research on it in the ADD literature. And so we've used that. We've used high dose omega-3 supplementation. Dr. Michael Lewis published a book called When Brains Collide, all about his research on high dose omega-3s as an anti-inflammatory response. And you can get Barlean's omega-3 fish oil. That's a really high quality triglyceride-based fish oil at Costco inexpensively in a lemon flavor that most kids like. And so they're not even taking a pill. So you can use that. And then there are a few other things that can be done to calm the inflammatory response. And then there are some medical devices that we use that calm inflammation, improve oxygenation, improve blood flow, and retrain the brain how to talk to itself. Because there's some signaling problems that happen within the brain with the hypothalamus that we can retrain using a medical device that's been around for a long time. So at least get some baseline testing and figure out, are you still dealing with issues? And then there are some options from there.
Right. Well, thank you. I appreciate that.
You bet.
Excellent. Excellent. Thank you. Lots of comments in the chat about excellent presentation. Another excellent presentation. Very informative. A lot of great information, Eric. Detailed enough and technical enough with not drowning us. So you do a great job of distilling all of that information and making it readily available for us. Really appreciate your education today. And I'm sure we would love to have you back again and again and again. One of the things I'm working on for third quarter is some red light education. And I have a very educated, knowledgeable speaker set up for that. So I'd like to have the two of you see if we can chat before she does her session as well on red light therapies, because I know we, meaning me as a participant in your health program, improving your brain health program, use lots of red lights in that program as well, and just how incredibly helpful that is. So Eric, I thank you so very much. I'm going to share my screen again here, and we are going to close today's session. So in addition to being our incredible speaker today, you're also one of our core sponsors for Learn, and we thank you so very much for your support, ongoing support, as well as your time and expertise and being a trainer, so that you're spreading this information and this knowledge out to a wider audience. So thank you, Eric, for being our presenter, as well as being a sponsor for Learn this quarter. In addition, I would like to thank again Oasis Senior Advisors for being a sponsor with us. And gosh, you have to have your cursor on the screen to go down. Just so everybody is aware, is that everybody will receive an email after this presentation inviting them to join our mailing list. If you are not currently receiving our mailing list, you must opt in to get it. We don't just assume that because you came to one of our education sessions that you want to be on our mailing list. We're not sure why not, but we need you to confirm it. Please check your junk folder for that invitation coming up. And here are the next training sessions that we have for this quarter. I'm very excited about every one of them. Death with Dignity, we have a representative from Final Exit that is going to be presenting and talking to us about some of the things that are happening in the world around ability to make choices at the end of life as well as through our life. Dr. Hassinger is going to be presenting on regenerative medicine and use of stem cells. Again, I am very early adopter, so I do all of these things. So he's helped me with my knees and my thumb. Oh my God, my thumb is so much better. Trust and conservatorships and fiduciary responsibilities. We have Trustco speaking to us on that. Effectively managing caregiving services. It's not something that we typically think about, but it is very important that we do have to be active participants in managing those services and making sure that we're getting what we need from them. Transforming your life after 60, boy, this is no wonder I love Learn. We're just doing all the things. Elder abuse awareness and prevention in June, and navigating your path to retirement with Peggy in mid-June. So we have a lot coming up, and we just really appreciate everybody being here with us today. And I thank you all for your participation. Eric, once again, thank you so much for the work that you do, you and Randy and your incredible team at Mind for All Season. I can't say enough in recommending your services personally, having been there, actually just being there this afternoon. It was a very stressful day. I came away feeling so much better. I could actually be a calm person today. So what you're doing is making a huge difference in the world. And in my world, Ralph Waldo Emerson has a poem that to made even one life just a little bit easier, to have made a difference is to have succeeded. And you, my friend, are right at the top of the list. So thank you very much for everybody being here today. And we look forward to seeing you at our next session.